Welcome back to Rhee, the Explorer's Life and Learning Hub. Today, we're diving into the sensitive topic of pelvic organ prolapse. Pelvic organ prolapse is a common but often underreported condition that affects millions of women worldwide. It occurs when the muscles and connective tissues that support the pelvic organs weaken, allowing one or more organs, such as the bladder, uterus, or rectum, to descend into the vaginal canal. Globally, it is estimated that up to 50% of women who have given birth may experience some degree of pelvic organ prolapse during their lifetime. In clinical settings, around 11 to 20% of women will require surgical correction for prolapse symptoms by the age of 80. The actual prevalence may be higher, as many cases go unreported, especially in regions where access to gynecological care is limited. Pelvic organ prolapse can significantly affect a woman's quality of life, causing discomfort, urinary or bowel issues, sexual dysfunction, and emotional distress. These symptoms can interfere with daily activities, physical mobility, self-esteem, and intimate relationships. But note that this condition is not life-threatening. The condition is worldwide in scope, but studies suggest a higher burden in low- and middle-income countries, where limited access to obstetric care, high fertility rates, and physically demanding labor contribute to increased risk. In rural parts of Africa and South Asia, for example, women often give birth at a young age and have multiple deliveries without adequate postpartum care, factors closely linked to prolapse development. In high-income regions like North America and Europe, the aging population and postmenopausal hormonal changes are key contributors. Yet even here, pelvic organ prolapse remains underdiagnosed and stigmatized, preventing many women from seeking timely care. Raising awareness and improving access to screening and treatment can greatly reduce the long-term impact of prolapse on women's physical and emotional well-being. Now let's review which organs are mostly affected and how the prolapse happens. Your pelvic organs, including the bladder, uterus, and rectum, are supported by a complex structure of muscles, ligaments, and connective tissues within your pelvis. This supportive system helps maintain the proper positioning and function of these organs throughout a woman's life. When these muscles or connective tissues become weakened or damaged due to childbirth, aging, surgery, or other factors, one or more of the pelvic organs can begin to drop or press into the vaginal canal. This condition is known as pelvic organ prolapse. One of the most common forms of prolapse is when the bladder and urethra descend into the front wall of the vagina. This condition is called a cystocele. It can cause symptoms such as urinary incontinence, a feeling of vaginal pressure, and difficulty emptying the bladder. To correct this, a surgeon may recommend a procedure called anterior colporrhaphy. During this surgery, an incision is made in the vaginal wall, the bladder and urethra are repositioned, and the surrounding tissue is sutured to reinforce support and prevent further descent. Another form of prolapse involves the rectum pushing into the back wall of the vagina. This is known as a rectocele. Women with rectoceles may experience difficulty with bowel movements, a bulging sensation, or discomfort during intercourse. A posterior colporrhaphy may be used to treat this condition. Similar to the anterior repair, this procedure involves a vaginal incision. The rectum is gently pushed back into place, and the tissue between the vagina and rectum is tightened with sutures to provide support. Prolapse can also occur higher in the vaginal canal, involving the small intestine. This condition is called an enterocele. In such cases, a vaginal vault suspension may be recommended. Through a vaginal approach, the surgeon repositions the small intestine and secures the upper vagina to strong pelvic ligaments to restore anatomical support. Uterine prolapse occurs when the muscles and ligaments that support the uterus weaken, allowing the uterus to descend into the vaginal canal. This condition is more likely to develop in women who have had multiple vaginal births, undergone menopause, or experienced increased abdominal pressure from chronic coughing, obesity, or heavy lifting. Symptoms may include a sensation of pelvic heaviness, tissue protruding from the vaginal opening, urinary or bowel dysfunction, and lower back discomfort. While mild cases can often be managed with pelvic floor exercises or pessary devices, more significant prolapse may require surgical intervention to restore the uterus to its natural position and reinforce pelvic support structures. In some cases, a hysterectomy, the surgical removal of the uterus, may be recommended, particularly if the uterus is severely prolapsed, or if other uterine conditions like fibroids or abnormal bleeding are also present. While hysterectomy eliminates the possibility of uterine prolapse recurrence, it is not always necessary for every case. Uterus-sparing surgeries, such as uterine suspension, are increasingly favored when appropriate, especially for women who wish to retain their uterus for personal, medical, or cultural reasons. For women requiring surgery, a common method is laparoscopic uterine suspension. This minimally invasive technique involves small incisions in the lower abdomen. A tiny camera, called a laparoscope, is inserted to provide a detailed view of the pelvic cavity on a screen. Using specialized instruments, the uterus is lifted and attached to ligaments near the base of the spine, providing long-term support without the need for a hysterectomy. Pelvic organ prolapse is a common yet often overlooked condition that can significantly impact a woman's quality of life. Fortunately, there are multiple surgical and non-surgical options available, tailored to each individual's anatomy, symptoms, and life stage. If you're experiencing signs of prolapse, consult a qualified healthcare provider to explore your treatment options and regain your comfort and confidence. But know that you are not alone, and more importantly, it is not life-threatening. While the symptoms can be uncomfortable or even distressing, prolapse is a manageable condition with a range of effective treatment options. From lifestyle changes and pelvic floor therapy to minimally invasive surgeries, there are solutions that can restore both comfort and confidence. Seeking help is a strong and positive step toward improving your quality of life, because living with prolapse does not mean living in silence or discomfort. If you enjoyed this journey with Rhee, make sure to tap that like button, subscribe for more adventures, and spread the word to friends who are eager to learn. Until next time, don't miss out on our next exciting exploration. Thank you for joining Rhee on this exciting journey filled with fun and learning. We can't wait to see you again on Rhee the Explorer's Life and Learning Hub, where more adventures await. Stay curious and keep exploring. Please check out a link to Pictory AI, which I used to generate this video, in the description.